So today there are 75 new cases of COVID-19 in the community that are part of the Auckland outbreak. All but one are in Auckland. There's also one other case under investigation that is almost certainly an historic case that is not related at all to the community outbreak. However, the other case that is not in Auckland today is in Wellington. It is a household contact of an existing case, and this person has been in isolation since the 24th of August. Of note with this case is that the person had returned 3 previous negative tests and before returning a positive test and remains asymptomatic. And this emphasises the importance of anyone who is a close contact or a very close contact seeing that 14-day period through and having that day 12 test. Now, this latest bounce in numbers is not unexpected. We did see this last April when our numbers went from 89 on the 2nd of April to 71 the next day, then 89 again on the 5th, and then 67 the following day, then continued to fall. And I've actually got a visual aid today, sorry, not an A3, I'm only A4 sized visual aids today, but you can see how that bounced around. And in fact, one of the numbers was 53 one day before it bounced back up. So if we look at the smoothing of the average over the last 3 days, it is clear that on average the daily case numbers are lower than the peak in the early 80s, but of course we will be watching carefully. Now, of note, just thinking about the cases we reported yesterday, there were 49. 57% of those were household contacts of an existing case, similar to the day before, rather than from exposures in the community. And 75% did not create any exposure events, similar to the proportion the day before, which was 77%. So that implies they've been isolating since lockdown or since being identified as a contact. So therefore, as I said, of the cases we reported yesterday, just 25% were considered to have been infectious in the community in the time before they were diagnosed. Furthermore, moving to the reproductive rate, the R value, based on the latest modelling, that continues to be promising, and there's a 90% probability that remains under 1 with the numbers coming through over the last few days, indicating that the number of cases will continue to decline and we are successfully breaking the chains of transmission. We are looking at the cases today just to work out what proportion of these are expected cases from testing of close contacts, in particular those that are day 12 tests from either household contacts or people who we knew about from a location of interest. As of this morning, there are 32 people in hospital. They're all in Auckland hospitals after the one patient who was in Wellington Regional Hospital was discharged yesterday back to a quarantine facility. Of those in hospital, 8 are in intensive care and 3 are currently ventilated. Another big day for testing yesterday with 22,158 tests processed nationwide. Demand for testing in Auckland remains strong with around 6,500 swabs yesterday across the Metro Auckland region. A reminder, anyone, wherever you are in the country, if you have symptoms that could be COVID-19, isolate within your bubble and get a test. On the wastewater testing result front, the latest results from ESR show no unexpected detections to report, and a sample collected from Moa Point here in Wellington on Monday has returned a negative result for the first time since the 19th of August. COVID-19 was also not detected in a sample collected on Monday from the broader Christchurch wastewater treatment plant. And while COVID-19 continues to be detected in a number of locations across Tamaki Makaurau, for the first time since the 18th of August, it was not detected in a sample taken from the Western Auckland network. Samples were collected from a number of locations in Northland yesterday, and those results are expected tomorrow as part of informing that final confirmation that Northland will be able to move to alert level 3 at 23:59 tomorrow. District health boards around the country nationwide have been impacted by alert level 4, and this has created particular pressures on the 3 Auckland Metro DHBs. We're working with our district health boards across the country to support the Auckland DHBs with additional staff, and I'd like to thank everybody who has answered the call there. And that includes a number of additional staff to help the frontline response in hospitals, as well as in the new quarantine facilities that are being stood up. There includes nursing staff in the hospitals, healthcare assistants and ICU specialist nurses as well. I do want to stress all hospitals around the country are open and able to provide acute care for any condition, and people should seek care as soon as they need it. Moving on to locations of interest. Out of an abundance of caution and after some discussion internally, we've decided to add a number of supermarkets as new locations of interest. So around 40 supermarkets across Auckland will be added to the website today. These are places that were visited by people who subsequently were identified as a case. A risk assessment has been done on each of them, and due to physical distancing in place, plastic screens, PPE use and so on, the events are deemed to be low risk. So, but people should look out, and if anyone has been in one of these, even if that was some time ago, the advice is just to be careful, watch for symptoms since you have been there, if you were there at the time and place that is indicated on the website. So no need to go and get a test, but just for awareness. And finally today, I'd like to give a shout out to all the workers in our diagnostic medical labs throughout Aotearoa. Yesterday, they processed their 3 millionth nasopharyngeal COVID-19 PCR test since the start of the pandemic, an amazing achievement and absolutely fundamental to the success of New Zealand's elimination strategy to date.